It's time to get the story behind the story. Interviews with newsmakers, news breakers, and Vermonters making a difference. WCAX presents 802 News with Mark Johnson. Here's Mark.
These days, more and more people are seeking health care at Vermont's free clinics. Thank goodness for the providers and volunteers, but the dramatic rise in the number of clients exposes a gaping hole in the increasingly unaffordable Vermont medical system. In this edition of 802 News, sponsored by Red Hand Baking Company, leaders of Vermont's medical safety net talk about why more people are coming through their doors, as well as the services they provide to the uninsured, the underinsured, homeless people, and those we depend on at harvest time and in the service industry. Their stories are simultaneously heartwarming and inspiring, yet also heartbreaking and frustrating. We begin with Olivia Sharrow, the executive director of Vermont's Free and Referral Clinics, the umbrella organization that supports the state's 9 clinics. I spoke with her and 2 county clinic leaders recently at the Vermont State House, where they explained their work and the help they provide.
Originally, as you can see in the name, Vermont's Coalition of Clinics for the Uninsured, in the 90s, they were formed really to try to care for people who didn't have health insurance. That really has changed a lot in the last 20 years, even in the last 10 years. In 2013, the majority of our patients were uninsured. Really small numbers were underinsured, single digits, like 3%. And by the time we sort of fast forward all the way to 2023, we have fewer uninsured patients than we do underinsured. So in 10 years, we've had more and more patients, and we've had more patients coming to us who actually have insurance, but are seeking free care, because they can't afford to go anywhere else.
Why do you think that change has happened?
Oh, I think it's a reflection of what's happening across the state. As things like the cost of housing, cost of food, transportation, coupled with hospital consolidation that's led to skyrocketing prices and higher insurance costs, more and more people are sort of pushed into this space where they're really feeling financially squeezed, and yet they have healthcare needs and they need a place to go, and that's why we're here.
How many people roughly do you serve in the 9 clinics?
13,467 in 20.
I said roughly.
Sure. So a little over 13,000, and that went up 17% from 2022 to 2023.
You're kidding.
No, I'm not kidding. In addition to that 17% increase, we also saw a 7% increase in new patients. So in addition to more and more patients coming through our doors, we're still seeing new patients. So there are still people that have never accessed care in our, almost 30 years of history, have never accessed care with us, who, have a new need and are still finding us. So we think, we served over 13,000 people last year, but the need is growing, and we still think there are patients out there that we could connect with and we could help.
That's an enormous growth in 1 year.
It's pretty significant. I like what I was explaining about the change in sort of insurance status over the last 10 years. It's a reflection of what's happening across the state. We saw a big jump in people coming to us with needs related to Vermont Health Connect and sort of insurance eligibility and navigation that we see as a direct result of the Medicaid unwind. There's a whole, I'm not going to remember the numbers now, but thousands of people that lost their Medicaid as a result of the end of the pandemic era. Non-closure policies, those people started receiving closure notices over the course of the summer, and our numbers for patients with health insurance navigation needs spiked almost 25%.
Can you help me understand a little bit more? I'm not aware of what the Medicaid change was.
Sure. So at the start of the pandemic, as people were losing their job, everything went haywire. One of the policy changes, one of the sort of healthcare policy changes that happened was that states stopped doing Medicaid renewals. So normally somebody, they apply for Medicaid, they get it, and then every year they have to resubmit an application, basically re-testifying that they're eligible for Medicaid. Medicaid closures and renewals stopped at the start of the pandemic. So it meant that anybody who became eligible for Medicaid or was already on it, so a lot of people who lost their jobs applied for Medicaid, they lost their employer insurance, they applied for Medicaid, got Medicaid, and then were able to stay on throughout the pandemic. And so, of course, Medicaid numbers swelled across the country. But so there was a huge group of people that had access to basically free, high-quality insurance for the duration of the pandemic. It was a really, really important policy. But as the pandemic isn't over, but as things have sort of returned to normal a little bit, states have started called the redetermination process, where they're asking patients to resubmit paperwork to kind of resubmit their income eligibility information. And many people have lost Medicaid or have transitioned onto a Vermont Health Connect plan, and we've been at the front line of that, both because we serve patients who are uninsured, we serve patients who are underinsured, and we also do a lot of health insurance navigation, help people with paperwork, help them interpret Vermont Health Connect notices and things like that.
Who are the people you're serving? Educate me.
Oh, that's tough. There are a couple of short answers. The shortest answer is no. There used to be sort of what I was explaining about uninsured Vermonters. We used to see the majority people without insurance and people with very, very low incomes. That's changed completely. Now we see people who have insurance, people who don't have insurance. We see people who are employed, who are unemployed, people who are housed, people who are currently unhoused. We see a range of ages, and it depends on the clinic. Individual clinics, they're working in their own individual communities and sort of tending to the needs of that community. So one clinic serves a lot of folks who are on Medicare. They do a lot of Medicare kind of navigation, helping people sign up, that sort of thing, pick Part D plans. There's another clinic that works in a part of the state that has large numbers of migrant farm workers, and so they serve as basically the primary care provider for that community, especially because for folks who are undocumented, their immigration status bars them from having insurance. So you can imagine, those people aren't going to be able to get insurance. They're not going to be able to sort of be part of the mainstream healthcare system. So there's a real range. It's not as easy to say, yep, these are the types of people that we see. And I think that's a reflection of some larger trends. More and more Vermonters, more and more people who are insured, people who are middle income, are being pushed into the safety net, and that's a really big deal. And I hope that people understand that we are the safety net. We're resilient. We'll be here for anybody. New patients are always welcome. But we also have a healthcare system, and also other systems in our state that are creating conditions that are leading to more and more people needing to use the safety net, and that's just not a sustainable system.
And why? What's your read on what's happening with the healthcare system that's causing that?
Oh, that's a good question. I think there are a lot of things happening. One of the biggest things that I see that's leading to more insured middle-income patients seeking care at the free clinics is the inability to access primary care around the state. It's an extreme lack of access to oral health, access to dentists, and mental health services. And because of how our insurance system works, Every year, our deductibles go up for people who have commercial insurance, which sort of leads to greater and greater exposure to healthcare costs anytime they go to the doctor. And because of consolidation within the rest of the healthcare system, hospitals can charge whatever prices they want, and that leads to higher premiums, and it leads to higher prices. When a patient goes to seek care, at the hospital, and they have a high deductible, it means that they're exposed to that, that full price. And more, you couple that with the other things that I've mentioned, housing, food, transportation, people just can't afford to get care elsewhere. Particularly with the pandemic, we saw a lot of providers not accepting Medicaid anymore. That's one of the issues with dental. We're seeing big increases with people coming to us with oral health needs, and a lot of providers just choosing not to accept Medicaid for dental. And that's changed a little bit. The dental reimbursement increased a little bit last year. We're starting to see some of those effects, but it's still a huge issue.
Who are the doctors and nurses and other practitioners how do you get them?
Each clinic is their own individual independent organization. 3 clinics are part of a larger hospital system, so they're a little bit different. But the clinics that are kind of standalone clinics, they're their own nonprofits, and they have relationships in their communities with providers. We had 591 volunteers in 2023, and about half of those are administrative volunteers, half are clinicians, doctors, dentists, physical therapists, you name it. There's a small number of paid staff. Each clinic has a director, and then kind of depending on the resources that they have, both their financial resources but also who they have as volunteers. Some clinics have to hire a couple positions like dental hygienists, registered nurses. But the clinics, they're operating in their own community. They're building relationships with community members. A lot of them have relationships with other local clinics or their local hospital. One clinic that's close to, it's in the Upper Valley in White River Junction. They have a really great relationship with the medical school at Dartmouth, and they get public health students. They get, medical students that get involved, volunteer. So it really depends on the clinic and sort of who they have relationships with and where they're operating. The clinics run on volunteers. That's really the biggest reason that we're able to provide the care that we do at the cost that we do, is because so much of the clinical services are provided by volunteers. They're provided by doctors, nurses, who love the work that they do and feel really strongly about patient care. And a lot of them report that they really like being able to volunteer in a setting where, they can take as much time with their patients as they want. Nobody's watching the clock saying, hey, 15 minutes, we've got somebody else coming in. And I say this about the clinics in general. It's a really different model from everywhere else in the healthcare system. We're not beholden to our chief financial officer. We do not get reimbursement per patient. We don't get a per patient per month. We get grant funding, and then we see as many people as we can in the time that we have based on the volunteer providers that we've got. And that's fundamentally different from the rest of the healthcare system.
I'm thinking to myself as I'm listening to you, I'm really grateful that you're out there, all these organizations are out there helping people, but at the same time, I can't help but feel the fact that you're there, the number of people you're serving, who you're serving, points up the failures in the American healthcare system. Do you feel that way too?
I do. I think that's completely true, and I said something sort of similar when we were talking to the speaker that I've been thinking about a lot. A lot of my role is sort of looking at the the high-level view, the total number of patients, and kind of trends year over year. And the reality is that even as our uninsured numbers statewide have gone down, and have gone down in other states that expanded Medicaid, even as those numbers have trended down, more and more people are seeking care at safety net organizations. And I just think, that more people falling through the cracks into the safety net is indicative of a system that is failing. That's not a sustainable system. And we do great work, and so I always try to sort of balance, we're grateful for our funding, we're resilient, we're not sort of saying, if you don't fund us, we're going to go away, or we're going to have to cut services. But it's not a sustainable system when people are just being pushed, more and more people are being pushed to the margins and are having to seek care at free clinics or go without, ration their meds, end up in the emergency room. Not only is it not a sustainable system from sort of like a high-level view, but it also costs everyone more when more people can't have preventative care, they can't get into primary care. There's a disjointed transition of care. And people are going to the emergency room. That's, one of the most expensive locations for care delivery that there is. And we exist to sort of keep people out of the emergency room. That's one of the things that we report on, is how much money we're saving in averted emergency room costs. But the reality is that there are all of these other things that we've talked about, and I'm sure, everyone knows. But we feel that we would love for there to be a time when the free clinics didn't exist. We would like there to not be people that can't get care in the mainstream system. But that's not the reality right now. And the real reality is that more and more people are coming through our doors every year.
What's your biggest worry about the healthcare system, I'd say across the country, but really here in Vermont?
My biggest worry personally is out of control hospital prices, because for me, I see that affecting all other aspects of the work that we're doing, and I see it directly affecting insurance costs, insurance premiums, the reasons that people are coming here because they can't afford to get care anywhere else. Medical debt. I don't even know the most recent number, estimate for medical debt that people in Vermont and across the United States are carrying. But that's affecting people's ability to buy food, to have housing. That's a huge, huge problem, and it's a direct effect of what the prices that are being charged at hospitals are.
Why do you do this?
I believe that everyone has a right to accessible, quality, compassionate health care. And I do this in particular because I used to work as an advocate talking to people who were having a healthcare issue, and that ranged from billing problems, insurance problems, unable to get, dentures needed, you name it. It ran the gamut of any healthcare issue you could possibly see. And so I feel like that really served as a crash course in all of the problems that can exist in the healthcare system today. And I see the free clinics as doing their part to try to mitigate some of that, whatever way they can, using absolutely every resource that they have access to, whether it's somebody who needs a vaccination, they need a dental extraction, they just moved to Vermont, they don't have insurance, they have uncontrolled diabetes, they don't speak English, they need food. The clinics, I really believe in the model that the clinics have of treating the whole patient. And if that means, a medical visit, great. If it means a medical visit plus arranging transportation for somebody to get to the DMV to get their driver's license reinstated, or a hot meal or a couch for their apartment because they don't have any furniture, that the clinics will do everything that they can to try to get whatever it is that that person needs to have some stability in their life. And I think that that's really important work.
We'll be back in just a moment with the leaders of the free clinics in Rutland and Addison counties. First, a word from our friends at Red Hen Baking Company. At Red Hen Baking Company, they believe pure, uncomplicated ingredients in the hands of skilled artisans are the building blocks for great food. They're dedicated to creating the best food from the best ingredients. You'll find an ever-changing lineup of delicious pastries, sandwiches, and soups at their beautiful cafe off Route 2 in Middlesex, just off I-89. Their breads are also available in many other locations. Led by owners Randy George and Eliza Kane, Red Hen Baking Company has been on the leading edge of the local food movement since 1999. Back to our discussion about Vermont's medical safety net. Up next is Tia Poalino, Executive Director of the Rutland County Free Clinic.
One of the things that impresses me the most about the Rutland Free Clinic is our ability to, I'm going to use that term that was kind of coined during COVID, pivot in a time of need. We're very good at that, and especially with the networks that we tend to, and partnerships we work very hard to make throughout the community. Right now, one of the little side services, it's a relatively new program, just started in October. We call it the Outreach Care Team. And what it is, it's an interagency effort to provide care for the homeless. So where they are, meeting them at where they're getting their meals, where they're getting other essentials, or where they may have a tent pitched, and trying to provide them with, care in a manner that is suitable for them. Many of these individuals have no trespass orders at the community hospital. Unfortunately, due to behavior issues, there's a lot of severe mental health issues, and there's other factors always. There's always multiple factors to these situations. But the fact of the matter is these are individuals in need of care, and they're members of our community, and they impact the public health of our communities. And so the Outreach Care Team is comprised of a team from the Rutland County Free Clinic that consists of a clinical volunteer from Vermont State Medical Reserve Corps, along with a field assistant. So it's a two-person team from the Free Clinic. It is a case manager from Rutland Mental Health or the Community Care Network. It is a peer counselor from Turning Point. And then there is the very valuable and essential component from the Rutland City Police Department. There is a commander from their outreach department. So that role performs the recon on those times during the week when the team isn't active. They're out there, they know where the people are, they're visiting with them, they're finding out the needs. So when the team gets together and goes out as a unit in the van, they know where, okay, we have someone that's pitched under River Street Bridge that we have to visit today. Or we know of someone who's going to be at the United Methodist Church for a meal with Companions in Wholeness, and they need some assistance getting their medication for their cellulitis. Or, so this started in October, and it's just a matter of, anywhere from 4 to 6 hours a week. The team goes out, but they go out every week, and they consistently show up. And we have little outreach cards. And another huge part is providing transportation to medical appointments, helping people pick up their medications, helping people take a shower and get clean clothes and launder their clothes. This is all something that, the Rutland City PD, as part of the Project Vision, is just instrumental and is making a huge difference. It's amazing how how just being clean and having clean clothes can change your perspective and even the way you feel about your health, about tomorrow, right? And some of the challenges that these individuals face and the hope it can give them.
What impact are you seeing, feeling, experiencing from the opioid crisis?
So the free clinic itself, we do not prescribe narcotics. We do not have any narcotics on hand. We typically, when we see individuals, and we certainly can, as providing primary care, it can come to our attention, and then we would refer closely with our partners. But it would be a warm referral. It's not handing someone a phone number on a piece of paper and saying, you should try giving this place a call. No, that it's, making contact with that partner and staying with that person as long as they need you until they're comfortable with that next connection they need to make progress. And that's a difficult, it sounds easy, it sounds caring, and it is, because everyone deserves the right to care. But it isn't always easy to make the connections that work and are effective. I will say, with the outreach care team, the agencies at play and the individuals that go out as a team are fantastic. They support one another. There's no silo efforts. It's a team effort. And oftentimes, I'll hear one remind the other, did you remember to talk to so-and-so about, even though that doesn't really help their agency, they're looking out for that other member of their team and want to make sure that they made that connection. So, and that's the way all of our work really should be and what we strive to accomplish.
Why do you do this work?
Oh, wow. I actually was not headed down the path of health career per se, but circumstances that no one would have ever predicted kind of landed me in the opportunity I'm in now. And I am grateful every morning when I wake up that this is what I do. There's so many ways that I do kind of miss working with people. I don't really get the direct contact with the patients and the individuals that I used to have. I guess when you grow in your career, the older you get and you climb the ladder a little bit, you almost kind of get sometimes a little removed from, that street level of, and that brings its own special component, and fulfillment. But yeah, I tell myself, somebody's got to find the money and somebody's got to work the programs. And so fortunately, that can be me. And I just feel like this is the type of work that my mother, when I had my first child, my mother said, she always would comment about how tidy I kept my home and everything. And then the baby came. And I remember the first time she came to my house to see the baby, and she noticed dirty dishes in the sink. And she had to comment because she never saw dirty dishes in my sink. And she says, she brought it up and she says, don't worry, she says, because your priorities are right. And those dishes aren't going to go anywhere. They're going to sit right there and they're going to wait for you, and this is the type of work where your dishes will never be done. And you have to be okay with that, Some days it seems like it took a long, long time to wash one dish. But you know what? One dish got washed today, and that's a good thing. It's that cup is always half full. You really need to, and then, just meeting the individuals. There's so many people, just our volunteers, for example, we have volunteers that have been with us for over 15 years. And we lost some volunteers during COVID, but the majority of them stayed. And the majority of them work and have jobs. So they were going to their jobs every day, putting themselves and their families at risk, and then working a shift for the free clinic on top of it. Now, how can you not have incredible admiration and respect for individuals like that and be blessed to work in an environment where people like that are? You know, it's I'm thankful to have the opportunity, and I look forward to every day.
You know, I think we're all fortunate, from what I'm hearing today, we're so fortunate to have these organizations here, but I also, part of me says they represent this deficiency, I guess would be the kind way of saying it, in the American healthcare system.
Well, I think what in life is perfect? And is perfection really something that is reasonable to strive for? I suppose maybe to work toward, but the idea that we could ever have a perfect healthcare system probably isn't very reasonable. So I don't want to be too hard on those individuals that really do make a sincere, tireless effort to work toward that, to improving a system that does seem to just generate issues. Sometimes one after another, it seems. I think, maybe the message is, all of the free clinics, the people who make free care possible are volunteers. Those individuals that know that they're never going to have all the dishes done in their sink, they all represent hope. And that's, I think, when things get really dicey, is when we start to lose hope.
Can I use that dish analogy when I go home?
You sure can. I'll tell my mom.
Up next is Heidi Sulis, the executive director of the Open Door Clinic in Addison County.
Last year, we served over 1,200 distinct patients. And of that 1,200, 48% were immigrant agricultural workers who are now actually getting into some other lines of business, leaving dairy and agriculture and going into construction, et cetera. But 48% of our clients were Spanish speakers. Another 4% were H-2A and H-2B visa migrant workers. And then the rest of those that we serve are, we were struggling with the term, other Vermonters, so to speak. And a big cohort of those folks are people who we all call patients within the free clinic, under the free clinic umbrella, but a number of them are folks who are seeking out the services of our health insurance assister, Melanie Clark. So she helps us, another free community service. We serve everyone from Middlebury College professors who are frustrated trying to navigate the system to folks with low literacy levels and co-occurring morbidities, help figure out their insurance options. So Melanie has been with us for over a decade in the role, and she's extremely knowledgeable, very tenacious, and is really helpful in supporting people trying to figure out plans, what plan is right for them. Vermont Health Connect is hard to navigate. There are a lot of plans. They're very nuanced, and people's lives are complicated. So picking out a plan isn't as easy as we sometimes make it out to be. I think people's lives are complex. People have blended families. They are dealing with lots of different kinds of situations, people in a household. And affordability is an increasing issue for a lot of folks. Even bronze plans can be deemed unaffordable by people we serve. And so I think what's really important and what's been so great about having Melanie is that she's one of the few remaining in-person folks who will actually sit down with people face-to-face or on the phone, but she's available. She's a real human being that people can talk to, relate to. She'll sit side by side with a big plan, with all the plans in front of them. And I think people find that immeasurably helpful in a world where it's increasingly difficult to talk to someone in person, not through a digital format, to get help.
You mentioned who you're serving now. Is that changed? I mean, is that a change?
All in all, not really. So over 12 years ago, we partnered with Bridges to Health and By State Primary Care and dove into a federal grant that was all about increasing access to care for migrant workers. And so back in 2009, we established an outreach program that has been led by one of our nurses, Julia Doucette. So for over a decade now, she has really dedicated herself and is very passionate about this work, along with the volunteers, to reaching out to farm owners, farm workers, telling them about who we are, what services we provide. And I think over these 12 years has built incredible relationships and trust among the agricultural community. Historically, our outreach program looked like going out to 40 to 50 farms every fall, providing health screenings, vaccines, health education, and once in a while some visits if we could take a provider with us. During COVID, we received some grant money from the state of Vermont to increase our outreach to the H2A and H2B workers as well. We'd always served a handful of H2A and H2B workers. So H2A workers are visaed agricultural workers. So in Addison County, they're often the Jamaicans who come to pick our apples, and then they might move on to the turkey farms and help with the slaughtering before the holidays. And then H2B, you see them in hospitality, for instance, folks at Basin Harbor Club and some of our resorts. So we'd always served a handful of those folks. But during the pandemic, we really began to increase intentional outreach to those populations of workers. So interestingly, that's one population that has increased in the last few years because we continue to maintain that outreach. And another thing that a big news splash for us is that in December of 22, through a very generous donor gift and community fundraising, and then another grant, we were able to purchase a Sprinter van, and we had it retrofitted to become what we fondly call our new exam van. And so for the first time in our evolution, we now have the capacity to have a safe, confidential, warm, dry space to see workers/patients when we're out in the field. Prior to that, we had some capacity, but oftentimes we were making do on a farm or in an orchard in a space that was okay, but not necessarily private, and not where you would want to have an encounter with a provider necessarily. So this has really opened up possibilities for us. The van is a game changer, and we have yet to realize its full potential, but I would say at this point we're really excited to have it and excited to think about how we can kind of expand our model of care. And we have all kinds of ideas floating out there in terms of, collaborating with the local eye practice, et cetera, and being able to take some of those professionals with us into the field to provide more holistic care. But I will say, on the other hand, I'm flipping back and forth, but I think one of the nice things is that we've been established so long that people do know where we are and feel safe coming to our clinic. And so at this point in our growth, we've been around about 33 years. We offer 7 to 10 clinics per month between our regular healthcare clinics and our dental clinics. We have an outreach program. We have our health insurance assistance program. And we just last year started a wellness program. So as you may have heard from some of my colleagues, some of the biggest gaps in care that we struggle with and feel challenged by in terms of meeting patient need are in the areas of mental health and dental health. We have a very unique and cool collaboration with Middlebury Dental Group, where Drs. Fasoli and Dr. Hopper open up their practice to us one day a week, which is when they have a free operatory available. We supply or hire a very part-time hygienist so that we can offer preventive dental care that way. And then we have a collaboration between Middlebury Dental Group and the University of New England out of Portland, Maine, which has an extern program. So they will send externs to us 3 times a year for 12-week rotations. And so the externs under the supervision of Dr. Fasoli will provide restorative care for our patients. So, I often say we are really proud of the dental program we can provide, but I would be the first one to say it's a drop in the bucket against the need that we hear about routinely. I think that, and those are the calls I think that our staff struggle with most because there aren't even options to point people to or alternatives. That's kind of, I think, where we are today in terms of primarily who we serve, what we provide. I often say our volunteers are our backbone, and without them we could not have the reach that we do. And we are so grateful for our volunteers. So all of our clinics are run by volunteers. So we have, for the past years, really tried to increase our recruiting efforts, so to speak, to find Spanish-speaking mental health providers, and it's really tough. And when they do step forward, they're often in a situation where they have a private practice, so they can only commit to 1 or 2 patients every month or 2, understandably. With some health equity grant money that was available through the state, we launched a wellness program early in 2023, maybe even 22, which I think the goal of which was to, through support groups, through some physical activities, and what else we might conceive of along the way, address some of the mental health needs of our patients, even if it's as basic as learning stress reduction techniques, understanding the importance of exercise, but also, I think, helping to mitigate the isolation they all feel by encouraging to get off the farms and cultivating that sense of place and belonging for them, because many of the migrant workers have been here for a number of years, and they're starting to put down roots. And so Elise Anton is our wellness coordinator, and she's done an amazing job of offering support groups to men and women. And she's now trying to get one off the ground for mums and babies. And she's done things like collaborate with Vermont Fish and Wildlife to have a fishing day for migrant workers and their families. This winter, she's provided skating opportunities, cross-country skiing opportunities. And it's amazing because, a lot of the people who've participated have never done these things before, that so many of us living in Vermont for however long we've been here kind of not take for granted, but think about and do without blinking an eye. So many people can go into their backyard on snowshoes. And so that's been, I think, very successful and gratifying for Elise to see kind of the joy that some of these things, the distraction, and allowing another space for them to explore this amazing environment and maybe begin to relate to it in a different way that they haven't before.
When you say patients, you use the word safe. What did you mean by that?
I think I just started my 12th year at Open Door Clinic, and oftentimes when people come to see us and talk to us about who we are and what we do, I think they're often one of the first questions they ask is, are people afraid to come see us? And, how they'll ask us all kinds of things around safety, are migrant workers targeted in our county, et cetera. So I think safe in the broad term that people, as people have gotten to know us and we continue, I think Julia's approach over the decade has been to show up and simply introduce herself and tell people what we provide, talk to them about what we provide, and encourage them to come see us. And I think that one person might have the courage to do that or the need to do that, and they come, they have a good experience. We provide all of our services in Spanish. We really try to address some of the barriers that they face, I think, through their daily life otherwise. And we try to provide health care in a culturally appropriate way. And so that's encouraging, and I'd like to think they generally have really good experiences with us, and so over time and through word of mouth, they come back and they feel, I think they do feel safe, they feel embraced, and then they encourage their coworkers to do the same. And I think we have a community in Addison County that collaborates well. We're really grateful for our partners, a number of us, whether it's the District Health Office or Atria, formerly Women's Safe, the DMV, whoever it might be, private practice offices that through Porter Medical, the UVM and the network offices. I think we support our mutual patients together through the network. And we do a lot of case management, and as Julie would say, accompaniment of our patients through the maze of services they need, which I think also makes not only for successful encounters and outcomes, but provides people with what they need to navigate that in a system that they're often completely unfamiliar with and looks very different than healthcare in Mexico or southern Mexico. And I think then all these things build a sense of confidence and feeling of safety when seeking out our services or services that are needed beyond our walls.
What do you think would happen if you were not there?
People would delay care. People would become more sick and ill. And I think a lot more of our patients would totally fall through the cracks. And that could be very bleak looking, ultimately.
That wraps it up for this edition of 802 News. Thanks to Eliza Kane and Randy George of Redhead Baking Company for sponsoring our program, and thank you for listening.